Myself, Dr.Mane, a gynecologist, a cancer surgeon, working for the SAIDHAM Hospital and Research Center. Today, I would like to discuss the myths and realities about the COVID-19 and the coronavirus. This COVID-19, a disease caused by SARS-CoV-2 virus, that is coronavirus. It was originated in December 2019 in China and proliferated very rapidly, propagated very rapidly throughout the world, overseas, affecting right now the 163 countries. People have lots of conceptions, misperceptions about this coronavirus. As we are very close to the social media and WhatsApp, that is why we immediately believes in WhatsApp and whatever news on the social media. But we should not immediately believe the WhatsApp news, articles, photos, videos, or these things on the social media. Everything has to be confirmed with your family doctor, consultant, or the people's expert in the COVID-19. So whatever news about the coronavirus are always not true that are given on the WhatsApp or Facebook media. Second thing, lot of patients used to ask me about any role of the Chinese food, any role of non-vegetarian food in transmission of virus. There is no any correlation between this virus and the non-vegetarian food. There are lots of rumors on the social media about this. That's why the prices shattered. But I would suggest that eating the non-veg food in this pandemic will boost your immunity, and immunity is very important to fight against the COVID-19. That is very important. Also, the Chinese food doesn't have any correlation with this virus. Second thing, this is the virus and it is transmitted by one person to another person by two ways. That when COVID-19 affected patient sneeze or coughs, he spreads the droplets or air particles within 1 meter of radius, and someone comes in that radius, someone comes in that 1 meter of distance from the COVID-19 patient, that immediately catches the COVID-19. The normal person catches the COVID-19 through the nose, ear, mouth. Also through eyes also cases reported. The second method of spread is when COVID-19 patient cough and sneezes on the table, sofa, chairs, whatever daily use items, and if a normal person touches that atom, touches that table, sofa, then if he touches that sofa and touches his own mouth, ear, nose or eyes, there is a high risk of transmission of that virus. These are the two ways where the virus can be transmitted. And one minor way is also reported in the literature, that is the stool, passes through the stool. Coronavirus passes through the stools, and that's if stool that contaminates in atmosphere, water, food, then it may cause it. That is a minor way, but major are these two ways. Patient always ask whether the pneumococcal vaccine, it is the first we will discuss the symptoms about the COVID-19. The symptoms resembles the pneumonia, symptoms resembles the common cold, symptoms resemble the breathlessness. Patient used to get cough, fever, breathlessness, then body ache, lots of symptoms. These symptoms resembles the common cold, viral fever. These symptoms resembles the SARS, lots of diseases. But these symptoms, if it is there, it doesn't mean that patient having the COVID-19. Patient ideally has to be tested for the COVID-19. That is the RT-PCR technique. It is available in the National Virology Laboratory, Pune. We used to send the nasopharyngeal swab for that. They used to culture the virus and they used to test for the RT-PCR. Within 2 days, we will get the result basically. That is the only way of detection of that virus. Virus is very peaceful virus. It causes very mild disease. If the patients or the peoples are of lower immunity, for example, patient is suffering from the HIV, patient is suffering from the cancer, patient is suffering from the some long chronic disease, patient's age is above 60 years. For example, patient is suffering from the thalassemia, hemophilia, cancer, different type of cancer, HIV, where the immunocompromised state is there, where the patient's immunity is lowered down. That is why this COVID-19 catches those people very rapidly, or these patients are the high risk factor to get the COVID-19. So these people should have the balanced diet, should have the regular checkup by the doctors. Whatever the tablets is going on, whatever the treatment is going on for their chronic disease should be taken regularly. Then you should be aware about the COVID-19. You should take the precautions told by the state government. Whatever the precautions, guidelines you should follow laid down by the state government. These are the things we should not forget. Third thing, people always ask to us about the mask. Which mask should be used and who has to use this mask? There are a lot of confusions about the mask. For the people who uses the cloth mask, paper mask, some used to tie the scarf, some used to tie the handkerchief, whatever available means people used to tie around the mouth. Basically, N95 mask is the only mask that prevents the transmission of virus. N95 mask filters the more than 0.3 micron particle size. That is why it is prevent to this virus. Your paper mask, cloth mask, whatever the routine mask, surgical mask will not prevent the spread of virus. And who has to use this mask? That is another question. First thing, all personals related to the medical activities. It includes staff, healthcare workers, doctors, lab technicians, everyone. That is mandatory to use this mask. That is compulsory for them. Second thing, the patient having symptoms resembling to the COVID-19. That might be the common cold, that might be the chest symptom, that might be the fever. They should compulsory have the mask. The purpose of mask is to prevent. The purpose of mask to this patient is to prevent the transmission to the another patient. Third thing, immunocompromised people should wear this mask comfortably. N95 tight mask is mandatory. Next question is, people says that whether pneumococcal vaccine is effective for this virus, because when the first case was detected in 1st December 2019 in China, that's why the name of the disease is COVID-19. That first case resembled a viral pneumonia, and within few days there was lots of cases in China. That's why immediately high alert was sounded in China, and immediately government agencies started investigating the things. They found this virus is similar to the SARS-CoV-1 virus. In 2002, SARS epidemic was there. So this virus is similar to SARS disease. SARS also having the same symptoms. So that's why the name was given to this virus as a SARS-CoV-2. This name was given. So pneumococcal vaccine is the antibacterial vaccine and it is a virus. So, no role of the pneumococcal vaccine in prevention of this virus, first thing. There is common question by the peoples is that any vaccine or drugs is available to the COVID-19. Till date, no vaccine or no drug is available that is can be called no anti-COVID drug or anti-COVID vaccine is available till date. The research is going on all over the world, and any vaccine to come up or any drug to come up, there is at least a 2.5 year procedure, norms laid down by the government. First, there is a testing by in the animals first, early and long term side effects studied, then testing in the humans, then early and long term side effects are studied, trials are taken place. So, Food and Drug Administration had laid down certain norms that every new thing, every research article or every new drug, whatever invented, that has to go through these phases, through this procedure. So, any vaccine or the drugs should be available to use in the market after 2.5 years. That is a mandatory part on behalf of government. So, lots of Facebook posts or WhatsApp post we read about the vaccine is invented, drug is available, drug is the research is taken by those. Lots of rumors are there around it, but people should be aware about these things, and we should not believe immediately. Second thing, the patient used to ask us that what precautions has to be taken by the pregnant mother. So, there is no additional precaution is to be taken by the pregnant mother. Whatever the precaution to the general public has to be adapted to woman. And second thing, the antenatal care under the expert guidance, under the doctor guidance of qualified doctor, iron, calcium, tetanus toxoid vaccination, whatever the treatment by the qualified gynecologist has to be continued perfectly during this period, and she should be taking all those undue precautions those are given to the general public. Second thing, a patient is suffering from the cancer or any chronic diseases, what additional precaution has to be taken? People used to ask me always. Those cancer patients, whatever the chronic disease patient, they used to be handled very carefully by the relatives. These are the high risk individuals for the COVID-19. The people should, whatever the caretakers, those people looking after him or her, this patient should be provided the good diet to boost immunity. Second thing, whatever the routine medicine has to be taken regularly under expert guidance. Third thing, any minor symptom in those people has to be reported immediately to the doctor or the government authority. So, very careful about this chronic disease. Only the additional precaution is needed for those patients. Old age individuals, the age above 60, these are the high risk individuals for the COVID-19. Also, one patient asked me yesterday only, the eating turmeric, eating cow's milk, then the use of the cow's gobar, gomutra, is this preventable to the COVID-19? No, exactly no. The turmeric contains, haldi contains the antibacterial element. So, that is antibacterial. Also, in Ayurveda, the cow's gomutra and gobar has a great significance, but these substances contain the antibacterial element. So, very difficult to say that this is we need an antiviral medicine, and these are it contains the antibacterial, but that's why this has no relevance to the COVID-19. Another thing, people used to ask me about the traveling. So, at this stage, the part of precaution for the COVID-19 is we should not do the traveling by the public transport. In emergency, we should go by your individual vehicle. We should keep the social distancing. At least distance between two persons should be 3 feet. and we should have the balanced diet, we should have good nourishment, we should avoid the crowded places, and also we should not create the crowd anywhere. Try to avoid to go to the places where the crowd is expected. Also have the use of the regular mask, then the good mask, that is N95 mask. If N95 mask is not available, then might be the little this simple mask or cloth mask, paper mask, might be some protection, but if it not available, then doesn't matter, we should use that mask, basically surgical mask. That is fine. Second thing, there is a chemoprophylaxis given by the government of Maharashtra. Some drugs are certified to use in the COVID-19, that is oseltamivir, hydroxychloroquine, azithromycin, ropinavir. For prevention, only one drug is certified by the government, because hydroxychloroquine attacks the genetic material of the virus. So hydroxychloroquine 400 mg twice a day for 1 day, then once a week for 7 weeks. This is dose for the healthcare workers, and for the normal people, the hydroxychloroquine, the dose is tablet 400 mg twice a day for 1 day, and then 400 mg once a week for the 3 weeks for the those people's, those contacts, or those people comes in contact with the suspected COVID-19 or proven COVID-19 patients. Means for the neighbors, relatives, family members of the COVID-19 or suspected COVID-19 or quarantine people, the drug usually is hydroxychloroquine for 3 weeks, and for the healthcare workers, doctors, that has to be used for 7 weeks ideally. That is the only chemoprophylaxis available right now, because that is old tested drug. 55 to 60 years we are using the chloroquine molecule for the malaria. That is a different molecule, that is not a chloroquine phosphate that is used for the malaria. That is also chloroquine drug, hydroxychloroquine, that is a different molecule of the chloroquine basically. Then quarantine. Those foreign nationals came in India after 15th February are labeled as a high risk factor for the COVID-19. They are immediately quarantined in the hospital. There are two types of quarantine. Quarantine means patient is kept in the abeyance, patient is kept in the certain rooms made for the quarantine, and patient is observed for any, whether he is developing any new symptom, any symptoms similar to COVID-19, and these patients are tested for the COVID-19, because incubation period of the COVID-19 is 5 to 8 days. If I catches the COVID-19 disease, I will likely have the symptoms after 8 to 9 days, 8 to 10 days basically. 5 to 8 days is the incubation period. If you are tested in the incubation period, it may be negative, that may happen. Patient may get symptom after 8 days. That's why the quarantine is given. Quarantine 14 days is given. Now the people's those are coming from the outside district also are quarantined. People coming from the foreign nationals also quarantined. There are two types of quarantine. One is institutional quarantine and one is home quarantine. Institutional quarantine means hospital quarantine, and home quarantine is different thing. For high risk individuals, there are foreign nationals, they are coming from the metro cities, they are quarantined in the institution, and those are the people coming from the outside district, normal places. Those came in the contact with the normal individuals, they are given the home quarantine basically. But everyone is tested basically. Any patient, if you are seeing in your vicinity resembling such a symptoms, then immediately report the government authority. It is a national responsibility in situation of national crisis. It is a duty of each and every citizen to report immediately any unlawful activity, any patient resembling such a symptoms of the COVID-19, any foreign national, any person coming outside the district, immediately report to the authority. That is our responsibility. Another factor is there is no correlation with the food about this disease. That thing is clear. No correlation of water with this disease. Okay. So when the healthcare workers enters in the house after their duty or community survey or the hospital works, whatever, The healthcare worker means paramedics, lab technician, doctors, everything I have included in healthcare workers. When healthcare workers enters the house, he should remove the shoes and chappals outside the room. That is mandatory. He should have the sun coat or long sleeves apron immediately remove and put in the box, basically separate box. Your mobile and the goggle should be cleaned with the sanitizer. Keep safe distance in the family. Avoid touching or kissing the children. If more rooms are available in the home, keep away keep the distance of at least 1 feet and share the different rooms. Should not share the single bed. That should be a priority. If you bring anything from the outside as a part of purchase, then immediately clean the thing with the sanitizer. That is important. Okay. Then avoid wearing the watches. Avoid wearing the ornaments in this pandemic. That is important. These are the seen unseen factors. Voluntary, involuntary, we may transmit the infection. Do not share the towels. Wash the towels immediately. And about pet animals, there is no documented evidence that this virus is transmitted in China from the pet animal. The investigation is going on. There are the evidences viruses are found in the wild bats in the Wuhan province of the China, but there is a speculation that the virus might have transmitted from that bats to the animals to the human. This might be the chain, but not proven. But there is no recommendation about the pet animals, but we should keep away the pet animals. That is our responsibility. Whenever pet animals comes in the home, immediately wash his food immediately with the sanitizer or clean it with the sanitizer. That is our responsibility. And vaccinate the doggies, cats as per their schedule, basically. Then another precaution, for the prevention, chloroquine is a single tablet. It should be prevented. It should be used very cautiously, and below 15 years we should not use the hydroxychloroquine. And those people suffering from some eye disorder, retinopathy, allergy to the chloroquine, or anaphylaxis reaction to chloroquine, that chloroquine intake should be avoided. Some people used to get the gastritis, severe gastritis with chloroquine, so that it should be avoided. And all high-risk individuals, including healthcare workers, should take the chloroquine. That is the priority. Second thing, immediately report to whatever the person comes in contact with you during this period, see his left hand for any stamp of the quarantine, because the foreign nationals, the people coming from outside the district, are immediately stamped for the quarantine. On left hand, left dorsal aspect, there is a date is written also for the quarantine. That person should not behave irresponsibly during quarantine period. He should not roam here and there, because the crime may be registered under section 188, that is Epidemic Disease Act 1897. The quarantine people should remain in the house, and he should not roam anywhere. That is his duty, because all government machinery, government servants, police, doctors are in continuous effort to stop the spread of the virus. This COVID-19 patients, out of 1000 patients, only the 3 or 2 patients need the ICU backup. This is very peaceful virus, not so aggressive. And when immunity is good, and in young people there is less chances of affection or diseased. So we should not have the fear about the coronavirus. We should face the pandemic with good moral, good confidence, and good knowledge. That is very important. Okay. Then another question people used to ask me about when COVID person sneezes or coughs, if he doesn't infect anyone, then how long the virus will be live in the atmosphere? If no one is there and he sneezes, coughs, when the air droplets are fallen on some material or tables, sofa, anything, then in that material or over that material or in atmosphere, COVID-19 or coronavirus will be survived for the 10 to 12 hours. Generally, COVID-19 patient infect the 3 people in 3 days, and again after 3 days 3 people will infect the 9 people, again after 3 days the 9 people will infect the 27 days. Such a chain of transmission is there for the COVID-19. That is why, putting wrong all the speculation in the world, that has spread from China to 170 countries, naviging the 170 countries. So very rapidly aggressive. So while going a message from SAIDHAM Hospital and Research Center that we have conducted the lots of training sessions to healthcare workers during this period, and the best sanitizer to use is, whatever sanitizer you are having, the sanitizer should contain the isopropyl alcohol 65%. That is mandatory. Also, the disinfection of hospitals, OPDs, vaccination room, the things related to quarantine should be disinfected by the hypochlorite solution, 4% hypochlorite solution. That is made by the mixing the 1 kilogram of bleaching powder in 20 liter of water, and this solution should be kept in a separate bucket. Separate cloth should be there to clean, and it can be sprayed, that can be disinfected at least 3 times a day. This premises should be disinfected with 4% hypochlorite solution or Lysol 4%, and 1% hypochlorite solution or 1% Lysol for the house cleaning, house disinfection, floor cleaning basically. For floor cleaning, this is sufficient. This can be made 1 kilogram of bleaching powder mixed in the 30 liter of water. At least 3 times a day we should be cleaning or disinfecting the room. That is very important. Though that the hypochlorite solution has some antiviral element, so that is the only disinfectant available right now. Lysol is also available. Okay. Then, so nothing to fear with COVID-19. I think I have enumerated most practical points for the COVID-19, and the take-home message is we should follow the government instruction given time to time. Second thing, social distancing. Third thing, eat balanced diet. Fourth thing, have a knowledge about the corona from the expert. And sixth thing, avoid the public places, avoid going outside. And I express my big thanks to the SWE 24-hour TV news channel for giving me opportunity to speak about the COVID-19. Thank you so much.